Thank you, everybody. Sorry that we're inside today, but obviously with the cold and the rain and what's going on today, we had to move inside in the wind. Before we get started, is this echoing on TV? Do you hear an echo, or do I have to turn it down a bit? You okay? Okay, all right, thank you. Just for the people watching at home, we're inside City Hall, and there's a large echo here today, so I just wanted to make sure everyone got the right sound here. The latest COVID-19 numbers here in Massachusetts as of Wednesday, yesterday, we had 1,137 confirmed cases, bringing the Massachusetts total to 150,498 confirmed cases. There were 36 new deaths reported yesterday, bringing the total deaths in Massachusetts to 9,700. In Boston, as of yesterday, we had 106 new cases in the city yesterday, bringing our total to 19,986. Today, we will hit the 20,000 case mark when our numbers come in a little later this afternoon. As a reminder of the reach of this virus, we still have much work to do to keep people safe. As of yesterday, we also had one new death recorded, bringing our death total to 778 people have lost their life in the city of Boston due to COVID-19. And as always, our prayers are with the families of the loved ones who lost loved ones and also who are still sick and suffering from COVID-19. Last week, the latest COVID test data for the week ending Saturday, October 24th, the average number of Boston residents who tested positive each day was an average of 121 cases. That's up from 95 the previous week. The positive test rate in our city the latest positive rate as of last week is 7.8%, and that's up from the week before, 6.2%. The data continues to reflect a steady continuing increase in COVID activity in Boston, similar to what many other cities and towns are experiencing statewide. It's not close to the level we saw in April, and hospital admissions for COVID-19 still remain lower than we saw at our peak. But the focus, all of us, must be to stop the spread of the virus and to turn around this trend. And we're definitely seeing a trend now. It's been 5 consistent weeks where we've seen these numbers go up, and we're not seeing, as of right now, any reason for it not to go up, and which is concerning to us. I'm going to talk about the steps that we're taking here in the city of Boston to stop the spread of the virus, but also get an accurate picture of where the virus actually is in the city. We're continuing to target the outreach in communities most severely impacted. That includes neighborhoods with positivity rate over 10%. And last week, it was Dorchester, Mattapan, Roxbury, Hyde Park, Rosendale, and East Boston. In the last 2 months, we have visited hundreds of businesses here from the city. We've distributed over 2,000 COVID care kits to residents and businesses with with information in several different languages. And that work's going to continue as we move forward here. We're also adjusting our reopening plans. We're using a cautious approach and using the continued cautious approach that we've taken throughout the beginning of this pandemic. Last week, we took Boston Public Schools fully remote learning. The health and safety of our students and school communities are our top priority. We're still going to be, we've paused the reopening plan until we see a consistent lower positive test rates. Boston Public Schools continues to work hard to make remote learning as best as it can be. The attendance numbers remain strong in online learning. Kids are signing into school every day. They're working to make sure students with the highest needs have the supports they deserve and they need. The superintendent is working right now with some providers on how do we continue to get some in-home services to our special needs students. We weren't able to do that in March at the beginning of the pandemic, but certainly we've learned a lot since then, so we're working on that plan right now. We've continued our free meals availability to all the kids in our district and the families with 98 food distribution sites throughout the entire city. That includes 26 Boston Public Schools where you can pick up a week's worth of food in a single visit. So you'll be able to go there and pick up the entire week food that we would normally serve our kids in school. To find all of these resources and locations, go to boston.gov/Boston Eats. We also need everyone to be smart and safe this holiday weekend. Halloween is going to be Saturday night. We want to remind families that trick-or-treating will be very different this year in our city. We're asking people there should be no knocking on doors. If somebody's not on the porch and they do not have candy laid out for you, you should not be knocking on their doors. We want to keep that face-to-face contact as low as possible. Also recommending that people place the individually wrapped candies on a tray in front of your house so the kids can come and take the candy off the tray. Or if you want to be creative, but we want to make sure that you keep a 6 to 8 foot buffer between you and the people coming to your house. We're also saying families should not go out as groups. We're asking families to go out in your own household to walk around if you're going to walk around and do trick-or-treating this year with your children. We're also asking people must be wearing proper face coverings. If a young person has a costume on, a costume is no way to walk around. They need to have on a mask as well. No substitute for a face mask. So if you're putting a costume on, having a face mask under that is really important. And also, I want to remind adults, there should be no parties this weekend. That's where we're seeing some of the numbers in our increases in daily positive rates are people under the age of 29, and what we want to do is keep those house parties not happening. It's something that it would help us to continue not having the spread. At the same time, Halloween is a holiday that lifts people's spirits, so we need our spirits lifted, certainly at this point in time. We are also suggesting a range of safe activities, like the Parks Department virtual pumpkin carving contest, which is going to be happening. And all of the Parks Department events, we're asking you to go to boston.gov/Halloween, and you'll get a list of all the different virtual events that we're having for Halloween this year. So it's not mandatory that you go out trick-or-treating, so if you feel it's safer to be at home, go to boston.gov/Halloween to find all of the other activities that we're suggesting. I'm also asking businesses and organizations to continue to prioritize safety. Yesterday, as you all reported, the Boston Athletic Association postponed next year's marathon until the fall. That's an example of a proactive caution that we need to continue to exercise here. So I want to thank the BAA's leadership for proactively taking swift action on the marathon. We have detailed guidance for each sector that builds on the state guidelines. I urge all employers to make sure that you're in compliance and providing a safe work environment for your employees. We talked about the role of parties in spreading the virus. We also have to focus on the workplaces so we don't see this spread in the virus. That's where many people are coming into contact. To look at all the guidelines that we've laid out, go to boston.gov/reopening. As a city, we're going to continue to follow the science, respond to the data, and work to support all of the residents in the city of Boston. The health and safety of our residents is our #1 priority and has been since the beginning of this pandemic, especially residents who are more vulnerable due to age, due to health, and due to loss of income. And as I've also said since the beginning, this has been a collective effort, all of us collectively working together. Normally I'd focus on personal precautions like wearing a mask, washing your hands with soap and warm water, avoiding large gatherings, cleaning down surfaces. Those things are important as ever, but I have a different focus on today, and it's a call to action. I'm asking everyone to commit to getting tested for COVID-19. Getting tested is how you keep yourself and your family safe, and it's also how we track the presence of the virus in our community. We need a more accurate picture so we can get to the focus on the response and have it in an effective manner. We've made great progress as a city expanding testing. We now have more than 30 active testing sites all across our city. You can learn more about these testing sites at boston.gov/coronavirus. There is a major advantage we have compared to our situation earlier in the pandemic. As of right now, we're investing more in testing resources, more in contract tracing capacity, and more in our ability to support people who need quarantine. But we have to make sure that the people using these resources, and despite increased access, we have seen the daily testing numbers fall off in recent weeks. As we head into a critical time, we need to turn that around. We need everyone to focus on how they can help. A question people have is, when should I get tested? Certainly, if you have symptoms like a fever, cough, shortness of breath, you should all get tested. You should get tested right away. Also, if you have a known exposure, meaning someone in your household, someone you work with, or who you've been interactive with, you should get tested. Who has tested positive, you should get tested as well. or if you've been part of a large gathering or have traveled. So if you've been at parties over the weekend and you don't know some of the people that were at the parties, a way to keep you safe and keep the people around you is to get tested. If you meet any of these criteria, you should get tested without delay. But as a city, we want to go further than that. We know that the virus is spreading among people who don't have symptoms and among people who don't know they've been exposed. So we want to be proactive. If you're leaving your house for any reason, you could be exposed. So I'm encouraging you to get tested and make it a regular part of your routine. For that reason, we've created mobile testing sites that test anyone free regardless of criteria. Right now, our 2 mobile testing sites are in Central Square in East Boston and Nubian Square in Roxbury. They are free and open to all. For other sites at community health centers, you should call ahead to find out what's available. If you have never been tested, I encourage you to get tested as soon as possible. Personally, I get tested on a regular basis. It's quick, it doesn't hurt. It's an opportunity to arm yourself with knowledge and be part of a community defense against this virus. If you get tested at one of our mobile sites, we're going to be giving out stickers that look like this one. This is where the props come in. So you'll get instead of getting an I voted sticker, you'll get an I got tested sticker. You'll get one of these stickers so you can help raise awareness and show that there's no stigma to getting tested. So it really is about asking people to go out and get tested as frequently as possible. We also recognize that many people need to work from outside the home, and your work hours might make it harder to find time to get tested. So I'm asking, and we're asking employers to support this push for getting tested as well, to make it easier for your workers to get tested. Today we're launching a tool to help you do that. It's called Boston's Testing Pledge. It's a commitment that employers and individuals can make to get tested and support testing access. We are taking the testing pledge here in the city of Boston and our related agencies. We're offering any eligible city employee 1 paid hour for every 14 days to get tested during work hours. Employees will receive regular compensation for their time spent going to get tested and will not be required to use sick time or personal time for that hour. Other employers can fulfill the pledge in the ways that work for them and their industry. All that you have to do is encourage your employees to get tested, provide them with the information about how and where to get tested. You can also consider giving your employees paid time off or other forms of flexible time to get tested during work hours. I'm asking every employer in our city to take this pledge, and individuals can take it as well. So far, we have more than 20 employers signed on. They include the Boston Red Sox, the Boston Bruins, the Boston Celtics, Bunker Hill Community College, Roxbury Community College, Ben Franklin Institute, Mass Challenge, Rapid 7, Wayfair, Stop and Shop, Local 26 Unite Here, the hotel workers, and other employers. I want to thank all of them for joining us in this pledge. It keeps your workforce healthy and productive. It prevents an outbreak that could hurt our businesses in our city, and it's a way to help our city avoid having to roll back reopening. And that's really the biggest part of this, is to make sure that we get accurate numbers so we're not seeing what's happening in other cities and towns across America where they're shutting down for the second and third time in some cases. The bottom line is that we're entering into a very critical time in this pandemic, the most critical since the beginning. The numbers have gone up, but they don't have to keep going up. We have the ability to make a difference right now. If we are vigilant and follow the guidelines, if we avoid gatherings, especially parties, if we make a commitment to getting tested, we stop the increase from becoming a surge, we can save lives and we can continue to recover as a city together. As we increase our vigilance, we also remain committed to supporting you through whatever challenges this fall and winter bring. For older Bostonians, we're asking you to take the precautions that keep you safe by staying at home as much as possible. And we have resources to help you with that. We can get you access to food and medication and deliveries, and also care and connection to help you overcome loss and loneliness. That's a problem heightened by this pandemic. We are also helping seniors pay their home repairs. Our Senior Saves program has 80 projects underway right now, so we're working with our seniors to be able to help them, whether it's replace boilers or some repairs that are needed around the house. If you're a senior and you have any concerns at all, please call 311 and talk to our 8 Strong Commission. They are there to help you. Anyone struggling with housing, the Renter Relief Fund is open again, with $5 million available to help pay rent. If you're a tenant who needs relief or a landlord who wants to learn more, we're asking you to visit boston.gov/housing stability. These have been very difficult times for renters and for homeowners and worrying about where the next check is going to come from or where the next mortgage payment is going to come from. If you're a homeowner concerned about paying your mortgage, you can reach out to your lender as soon as possible to find out what flexibility they will offer. In the beginning of the pandemic, many of them put the payment of your mortgage on the back end of your loan, and many of these lending institutions are still willing to offer supports. You can also check in with the Boston Home Center. They have programs that you might be eligible for. So homeowners, make sure if you're looking for programs, check in with the Boston Home Center. You call 311 and we'll connect you to that to help you stay in your home and help you keep your home. We also need everyone safely housed as the winter approaches and this pandemic continues. We remain dedicated to helping small businesses make it through this difficult time as well. So far, we've distributed over $9 million in relief in our reopening funds, and we still have grants available. If you have any questions, concerns about this, we want you to reach out to our small business office by emailing smallbiz@boston.gov. That's smallbiz@boston.gov. I also want to thank our larger companies that have stepped up to help small businesses in our city. Simply Safe is a national leader in security based right here in downtown Boston. Simply Safe worked with us to donate 250 security systems and 12 months of professional monitoring for small businesses in our city here in Boston. I want to thank Simply Safe for your help, and I encourage everyone to support our small businesses however you can. For our most vulnerable residents, we continue the work of the Boston Resiliency Fund. This week, we invested in community organizations that are caring for our neighbors in Dorchester, Roxbury, Mattapan, South End, Chinatown, and Charlestown. That includes a free COVID-19 testing site in Grove Hall at Prince Hall Grand Lodge on Washington Street. The work of churches in the Black Ministerial Alliance to provide food and basic needs to seniors and families in our communities throughout the city of Boston. And the work of the Asian American Civic Association to help seniors and disabled in Chinatown. In total, we have brought $28.4 million into our communities through the Resiliency Fund in helping in various different ways. I want to thank, once again, all the nonprofits doing selfless work and everyone who has donated to the Resiliency Fund. We continue to be there for our most vulnerable neighbors, and we will continue to be there for as long as it takes. I want to close by talking about the election. This is a historic election, and there's tremendous interest in voting early and voting safely. We are committed to making sure that voting is safe and accessible to all. I know there was concerns about the incident in Copley Square on Sunday. I want to thank the Boston Fire Department, the Boston Police Department, the Elections Department for their quick response, as well as our state and federal partners. I want to assure voters that we'll do everything to make sure that there's no threats to our ongoing voting system. We are doing whatever it takes to protect safe access to the ballot boxes. So between mail-in voting, in-person voting, and early turnouts is record-setting. As of yesterday, more than 138,000 Bostonians had casted their ballot. That's 32% of all registered voters here in the city of Boston. Just by comparison, in 2016, we had, for the entire election, 277,000 votes cast, of a turnout about 67% of the entire general election. So it looks like we're going to be on pace to go far beyond that number this election season. I want to thank our election department and all the workers and volunteers for doing incredible work to make sure that we're moving our democracy forward here in Boston. They're working hard and they're doing an amazing job. And I encourage everyone, whatever method you use, make a plan now and vote as soon as possible. Early in-person voting continues through tomorrow. Tomorrow will be the last day for early vote in person. At our 17 drop boxes will be available to deposit your mail-in ballots through 8 p.m. on November 3rd. So November 3rd, on Election Day at 8 p.m., we will shut those boxes down. So if you have a mail-in ballot, you can drop it off in the drop box. Keep in mind, this is all per state directive. On Halloween, important note to pass along here, Drop boxes will be emptied and locked at 5 p.m. Saturday until Sunday morning due to safety concerns. So after 5 p.m. on Halloween night on Saturday, you will not be able to drop your ballot in that box until Sunday morning. So if you plan to use the drop box this weekend, do it on Saturday morning or all day Sunday. If you put your ballot in the mail, it must be postmarked by November 3rd and arrive at the election department by November 6th. For in-person voting, every site is a COVID site. For every site is wheelchair accessible with an auto mark machine for those with low vision or limited mobility. For more information, visit boston.gov/elections or call 311 if you have any questions around voting. Finally, I know that many people are experiencing lots of anxiety around this election, and it's heightened by the pandemic and everything that's at stake. I encourage everyone to take care of your mental health. Do not be afraid to talk to somebody or ask for help. You can reach out to a healthcare provider or a trusted community organization. You can call 311 and we'll connect you to the resources that you need. And I encourage everyone worried about the national events to look to unity and compassion here in the city of Boston. Whoever you are, whatever your identity, whatever your struggles, we respect you, we support you, we'll continue to support you. As a city, we're doing what we need to do to get through this pandemic and these difficult times. We will keep doing the right thing, we'll keep moving forward, and we'll keep being here for each other no matter what. With that, I'll open up for questions to myself or Marty Martinez. Yeah, I'll spend a lot of time talking to the commissioner. I was on the phone today with the ACLU, community organizations about preparing for election day and election night. First and foremost, intimidation at the poll will not be accepted in the city of Boston. There'll be no voter intimidation at all allowed, and we generally don't see it. But in this year's election, there's been lots of rumors and social media about this stuff, so we're not going to tolerate that. We're going to make sure that election day, people that go in-person voting will be able to do so peacefully, uninterrupted. We're also making sure that as we think about, I think it really depends upon what the election result is at night and what's going to happen. We're going to have proper coverage at our polling locations and around the city of Boston, both by Boston Police Department as well as many community organizations that are going to be making sure that there's a safe election. I'm going to have a press conference on Monday. We're going to talk more about election preparation on Monday as we get closer. There is no known threats right now at all to the city of Boston or to the Commonwealth that I'm aware of any type of disruption on election day.
We've already heard that there will be demonstrations on the Common and elsewhere. Regardless of who wins or lose, people seem to be wanting to come out and gather the day after the election.
Yeah, that's going to be part of our election day conversation. It's not just election day, it's going to be election eve, election day, and possibly some days after the election, depending on what happens in other states. I mean, I'm pretty confident that Massachusetts the results will be called early, and we'll know who won the presidency here in Massachusetts. We'll know who won our United States Senate races, all of other races. There are some states around the country that they're talking about days of delay before the results are found out. We are preparing for any type of demonstrations that might happen on Wednesday and Thursday and Friday. I'll talk more about that on Friday as well. We're still working on plans right now, but I'm anticipating there'll be demonstrations. No, there's no question about it. There'll be demonstrations probably on both sides on victories and losses. What's kind of alarming to me is that the preparation that we're putting into this election, we've never had to put into election before. I don't think any mayor before me, I certainly wasn't asked in 2016, what's your safety plan for election day? We just went along with our democracy, and it really shows the divisiveness in our country right now. And I'm hopeful that I'm just asking everyone, regardless of what happens on Tuesday night, be respectful of each other. Be respectful of each other's Bostonian, fellow American as we move forward here. And I'll have more to say on it Monday. I'm hoping I'm celebrating. I mean, I think as the mayor, I try to do that every day. I mean, I don't represent Democrats, I don't represent Republicans, I don't represent independents, I don't represent the Green Party, I don't represent unenrolled, I represent everybody. And I think as Boston, when we think about our policies and how we move forward, it really is about creating opportunities and continuing to be an open city. And I think in the last 3.5 years, there's probably been nothing that I've agreed with, or very little that's come out of the White House, but we continue to talk and fight for women's rights, LGBTQ rights, immigrant rights. That's what we're going to continue to do. And in Boston, we haven't really seen the divisiveness that I was on a call the other day, 2 days ago, with mayors from around America, and a lot of those cities have seen a lot of divisiveness in their cities, and we are too in some ways, but ours is really focused on systemic racism and how are we going to work to address those issues, those systemic issues that we're moving forward. So as a mayor, we do have to go back to some sense of respect for each other. The tone of this election and the tone of the national conversation has just disrupted so much, and I think that having, depending on what happens on Tuesday night, I'll have more to say about that Wednesday, but hopefully we go back to being a people that respect one another, because that's not what I'm witnessing today. I see it in Boston, but I'm not seeing it around the country. Well, we've cut back on. Sorry, I should be repeating the questions. The question is about, the last question was about the election and about after Wednesday, what happens if, depending on what happens, how do we bring people together? And that was my answer. This question now from Sean is about the coronavirus. Isn't it time to start shutting things down? As a matter of fact, in some cases we have. We have all online learning now for our kids. A very difficult decision last week. I know there are parents that were here yesterday letting their feelings known that their kids made, even in the short time they were in school, made some big gains. We have to do everything we can to get those kids back into school. By bringing the number down helps them get back into school. We had not taken moving forward with the next step that the state announced a few weeks ago. We have not gone to 10 people at a table in restaurants that the state announced a few weeks ago. There's a lot that we haven't done. I think in schools, our rate is too high right now, and quite honestly, I think every city and town across Massachusetts, if your rate is at 8.2%, you really have to think about, is it the right thing right now? It's a difficult choice. It's bad choices. But we're also working with Marty Martinez in public health, and we're looking at what does it mean to roll some of these other places down. So today I announced testing. The reason for this testing is to get an accurate number on where we are with the virus. We have a number of what we have, and we're going to see a couple things. Number one, more testing, we could see a higher positivity rate, we could see a lower positivity rate. But what that number will give us an accurate assessment of exactly what we're dealing with. Contract tracing is another piece. We're seeing cases not necessarily being traced back to 1 or 2 or 3 or 4 events in the city. It's kind of spread across the city. So having all this information at our fingertips that we didn't really have, or I didn't understand in January, in March and April, having it now really helps us guide on what we want to do next. I'm going to ask Marty. I think a few 100,000. How many tests have been done in Boston? We'll get the question is how many tests have been done in Boston. I think Marty told me about 300,000 people in Boston might have been tested, but so about 300,000 residents have been tested at least once, but many more tests have been done. I think the testing's dropping off because I think people feel that it's not them, it's somebody who's testing positive. I think that to some degree, we've put our guard down a little bit. I think some folks have definitely put their guard down a little bit, and now's the time to intensify our precautions. The experts have always said that the months of November and December in America, and in all across America, we will see big numbers of COVID-19 positive tests in America. In the next breath, they also said, but we can prevent that by taking the safety precautions that needed to keep the numbers down. Part of the testing protocol that we want to do, and part of just continually putting information out about wearing masks and physical distancing and social distancing, all of that stuff is serious. We have to take it serious. And because what's happened in March, in April and May, we saw emergency rooms in our hospitals where most elective procedures were shut down. People couldn't go in for elective procedures. the hospitals predominantly became COVID hospitals. We don't want to get back to that day. We don't want to go back to that, because that's something that puts us in a whole different place. That goes back, that affects our kids, where we can't go in-person learning in school. That affects our restaurants, where they have to shut down. That affects our retailers, and we have the holidays coming. And the last thing that we want to do here is have to shut down all of our restaurants and our retailers during the holiday season. I mean, they had a bad year, and that might be an opportunity for them to make a little bit up during that period of time if we can keep the number down. And right now, for the last 5 weeks, that number's gone in the complete wrong direction, and it's a direction that I don't like seeing. And the last 2 weeks we've gone up a whole percentage point per week. So we've had incremental gains, and then we went from 5.4, I think it was, to 6.7 to 7.8 and to 8. So we're jumping pretty high. I'll come in. I love that. Yeah, we did. I just really read that story right before I came down. Somebody sent it to me, and I have not had a chance to talk to Marty Martinez about it, but I will. The issue is, this is about a story that was in the paper on one of I forget who did it, but there was a story about Tufts partnering with the city of Medford and the city of Somerville and doing testing for all the students in those schools once a week, and that's where we want to get to that point. The issue in Boston is that we have 57,000 kids in our school district. That's just in our school district. If you add in charters and parochials, we're talking about probably 80,000 kids. So it's about capacity at that point. But that's something that we are going to explore. I have not had a chance to talk to Marty Martinez about it yet. I literally read it 5 minutes ago. The question, the comment is that Germany is shutting down for the month of November, the entire country of Germany. I think if we did that in the very beginning of this pandemic, we would be in a lot better position in place than we are today. We would have had certainly a lot less loss of life, a lot of other, now we're hearing other medical complications after you get COVID. It's not simply getting COVID and you get over COVID and you go back to your normal life. This talks about affecting your brain, affecting some of your organs. That was something we should have done in the beginning. I think that we need consistency in messaging, and I think that that's something that has not been happening here. I can't necessarily say if that's what we need to do around the country right now, but we do have most of the country, from what I understand, and looking at the map, most of the country is what's regarded as a hotspot right now. We are not one of those places. We in the beginning of this, the Northeast was a hotspot. If that continues to move forward, that is something that we probably have to look at doing potentially, or shutting down major industry, or shutting something down to contain this virus. Many countries have done it in Europe already, and they've done it successfully with very little pushback, because they understand it's about stopping the spread of the virus. Okay, the question is, am I confident today, with the numbers of cases going up, that hospitals have the ability to handle any type of increase and that they have better treatment? There's no question that there seems to be better treatment, and the hospitals have figured out, in some cases, how to treat most people with COVID-19. I'm confident today that the hospitals can handle it. My concern is if this number continues to grow, and let's just say, for sake of argument, we get 2 or 3 super spreader events that happen in the city of Boston where tens of thousands of people are infected because of whatever, a party or whatever it is, then there'll be concern. The hospitals will have concern. I know I'm in close contact with many of the hospitals now, and they're definitely seeing an increase. They're not seeing anywhere near what the numbers were in April and May, but I certainly, in the back of my head, I have some concern. I didn't think, if you asked me 3.5 weeks ago, that would be at 8.2% today, I would tell you no. There's no way it would be there, because we were kind of just moving along and going up and down, kind of a little bit like a roller coaster, but not high. And in the last 5 weeks, we just kind of shot up. So I definitely have some concerns there. I don't know, Marty, you want to talk? You want to just jump in? I'll let Marty Martinez talk a little bit about the hospitals too. Yeah,
I mean, I think to the mayor's point, the hospitals not only have better prepared for any surge, but they're also better prepared to take care of people. And so I think you'll see, and we've seen this in our hospitals now, although there's a slight uptick in the emergency room, slight uptick in hospitalizations and the ICU, there's no question that folks are better equipped to not only handle the situation, but are prepared for what's to come. So to just give you sort of ballpark, we see, I think, roughly 100 plus COVID positive patients in the hospital right now in our Boston hospitals. At our highest peak in our surge, we were close to, I think, 1,500 folks in the hospital around COVID positive here in Boston. So we're not at those numbers, but our hospitals responded incredibly then, and we're working with them to make sure they're planning for and able to respond if we were to get to those numbers again.
And on Monday, we'll have more updates on the election. We'll be able to come in and talk about the election. I'm not sure what time it's at, but we'll figure out. So thank you, everybody.